Hello, everyone. Thank you for joining us today at our virtual reality Naloxone training webinar. I am Shan Willis with the Department of Mental Health.
I am Maggie Roberts, State Opioid Response Director at Department of Mental Health.
We are thrilled to partner with CACA and Walmart to present this unique experience. CACA launched this simulation in February of 2020 at their National Leadership Forum. Since then, they've had more than 25 virtual screening events and engaged thousands of participants. We look forward to seeing this initiative reach countless more communities. We will hear from a wonderful group of speakers here in Mississippi who are working every day to save lives. Then we will view a virtual reality simulation developed by Walmart and demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. Our goal is to learn how to use this technology to help community leaders like you save lives and create a norm that every life is worth saving. Now I am pleased to introduce our first speaker, CACL's Chief of Staff, Valentino Murphy. Valentino joined the CACL's team in 2021 and has been working ever since to help further their mission of building and maintaining safe, healthy, and substance-free community. We are thrilled to have him with us here today. Valentino.
Hello, everyone. I'm thrilled to be here. First, I want to extend my gratitude to Walmart for their commitment to saving lives through this innovative training. For some of you, this will be your first time using a VR headset. If so, I encourage you to embrace the experience and the training that comes with it. And yes, your head will be moving around. I'd also like to thank our friends and supporters at the Mississippi Department of Mental Health. It's an honor to be here alongside such remarkable leaders from the great state of Mississippi. CACA has a footprint in over 30 countries and leads more than 7,000 coalitions across the United States. We work with community residents and leaders to develop coalitions and reduce substance misuse by adapting CACA's model for community change. CACA knows that prevention is the most cost-effective way to reduce substance use and misuse. The emphasis on prevention is more crucial than ever before. The CDC reported that there were over 107,000 fatal drug overdoses in the United States in 2023. So let's put this in some perspective. That number would be the same as losing 7 out of every 10 people in Jackson, Mississippi. This is why leaders and community stakeholders like yourselves are crucial. You are really the true heroes in driving positive change. Our partners at the Drug Enforcement Administration continue their One Pill Can Kill campaign, which has raised awareness about fentanyl-laced pills that are killing so many fellow Americans. In 2023, the DEA seized more than 80 million fentanyl-laced fake pills and nearly 12,000 pounds of fentanyl powder. The 2023 seizures are equivalent to more than 381 million lethal doses of fentanyl, more than enough to kill every American. Their message could not be clearer. The only safe medications are the ones prescribed by a trusted medical profession and dispensed by a licensed pharmacist. As DEA Administrator Ann Milgram shared at CACA's 2023 National Leadership Forum, this is not a war on drugs, but a fight to save lives. We also need to be vigilant of trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine, also known as tranq, as a key emerging threat and has been identified in all 50 states. It interacts with opioids in a devastating way that leads to overdoses. In a report to the White House, the Office of National Drug Control Policy stated that community-based programs, such as yourselves, will be among the first to interact with individuals vulnerable to fentanyl contaminated with xylazine. In this current landscape, we need every available tool to save lives and help our communities recover from this drug crisis. This gathering today and the Walmart-sponsored innovative training is a huge step forward. Keep up the good work. I look forward to seeing you soon. Back to you.
Thank you for joining us today, Valentino, and for all your leadership across CACA in this work.
Turning to our wonderful group of speakers from Mississippi, we're happy to introduce you to Colonel Maxwell, the Administrative Officer of the Mississippi Department of Public Safety. Colonel Maxwell is a seasoned law enforcement officer with 29 years of public service as an agent of the Mississippi Bureau of Narcotics, where he served in a variety of roles, most recently as director. He has received numerous accolades, including the MBN Clyde Stuckey Award for a sustained and superior record of service, along with the Bureau of Narcotics Directors Award for outstanding performance and contributions in furtherance of the agency's mission. Stephen has fielded hundreds of presentations on various topics, ranging from leadership, education, substance use prevention, and others attended by thousands. Colonel Maxwell, we're looking forward to hearing from you.
Hello, my name is Stephen Maxwell, and I am delighted to be able to just share a few words with you today with regards to what we're doing in Mississippi as it relates to issues that appendage out of the drug culture, specifically associated with drug-related overdose deaths. I've been working in law enforcement for more than 29 years now, and it's come to be extremely evident and prima facie to me that the largest number of individuals that comprise the drug culture here in the United States are dealing with a substance use disorder. These are people who are either using drugs as a result of some diagnosed or undiagnosed, untreated mental health issue. They're suffering from the effects associated with a past trauma. Individuals who are better suited for treatment and recovery as opposed to incarceration and prison. These are the individuals who unfortunately are overdosing and dying as a result of their drug use and their substance use disorder. And so expanding the distribution of naloxone, putting naloxone in the hands of every Mississippian, ensuring that every Mississippi family has naloxone in their possession, allows us to be able to extend the timeline for these individuals who are battling the disease of addiction, who are in the abyss of addiction, to get the treatment that they need, that they can hopefully transition into recovery and be reintegrated back into the communities, back with their families, and back into society, and use the skill sets, talents, and abilities that they have to become the person that they once were prior to addiction, to become the person that they have hoped to become, that they've dreamed to become, that they have aspirations to become. And so we're doing that through partnerships with other state agencies like the Mississippi Department of Health, the Mississippi Department of Mental Health, of course, is how the Bureau of Narcotics became involved in the naloxone saturation Policy Academy, as well as nonprofit organizations like the Mississippi Public Health Institute and First Responders for Mississippi. These agencies and these organizations have an intersecting goal with the Mississippi Bureau of Narcotics and the Mississippi Department of Public Safety, which is to save the lives of Mississippians. And when we save lives, we save families. When we save families, we save communities. And so that partnership started off with a data collaborative, and then that data collaborative grew into what can we do collectively as organizations, as agencies, and as a group to implement programs, seek funding for those programs, try to work with other states and discuss what they're doing in their state that works and how we can implement those things that are appropriate to do here in Mississippi, and layer those into existing programs, and maybe give us an opportunity to resuscitate previous programs that had aspects of that worked also with regards to not only reducing drug-related overdose deaths, but reducing the initial initiation of drug use, whether it is with the initiation and the use of illicit drugs or the initiation and the use of misuse and abuse of prescription drugs as well. We hope to be able to create an option for law enforcement that allows us the ability to not only be able to administer naloxone in the event that we come in contact with an individual and that person is experiencing an adverse reaction to a drug ingested, that adverse reaction leading to overdose and the overdose leading to death, but give us an option rather than taking that person to jail when it is clear that they're dealing with a substance use disorder or a mental health issue, but take that person to a crisis stabilization facility where they can be monitored through the course of their bodies metabolizing the drugs that they've been ingested. They eventually can be assessed, and hopefully it can be determined if they're dealing with some greater issue that is causing them to use drugs, whether it's a misuse and abuse of prescription drugs or the use of illicit drugs as well. Thank you.
Thank you, Colonel Maxwell, for being a dedicated public servant to the state of Mississippi. Your work is irreplaceable, and we appreciate you. Our next speaker, Dr. Randy Easterlin, has been involved in family medicine and addiction for over 30 years. In November 2011, Governor Phil Bryant appointed Dr. Easterlin to head his care transition team, and in 2017, he appointed him to serve as vice chairman for the governor's opioid and heroin study task force. In 2020, Dr. Easterlin was appointed by the American Medical Association to serve as one of 20 physicians nationwide to serve on the AMA's task force on the medical use of marijuana. In 2022, Governor Tate Reeves appointed Dr. Easterlin to serve on the Medical Marijuana Advising Committee. Dr. Easterlin is CEO of West Mississippi Medical Services that provides health care services on a contracted basis. He is now contracted with Harbor House of Jackson as medical director to provide addiction treatment services for the state of Mississippi. Dr. Easterlin, please take it away.
Good day. My name is Dr. Randy Easterlin. I practice addiction medicine in Vicksburg, Mississippi. I'd like to take just a moment of your time to tell you about a life-saving drug that I personally have used on a patient. Of course, what we're talking about is Narcan, and which is naloxone. Narcan is an opioid antagonist. What it does, it basically removes the opioids off the receptor site and prevents it from having the opioids from having its lethal effects on the human body. We've used Narcan for years. I used it in medical school 40 years ago, but about 15 or 20 years ago, they came out with a nasal preparation, which makes it easy to use just about anywhere. And that, of course, is what we're all encouraged to use. I'll just give you a brief example. About a year and a half ago, the day before Thanksgiving, 2022, I was leaving a restaurant in Vicksburg, and I looked to my right and saw a vehicle that was careening across the parking lot. Fortunately, the automobile did not hit anyone or any other automobile. It did go over the curb and finally crashed into a coffee shop. At that time, a group of people crowded around the vehicle trying to get in, but the door was locked. Long story short, as they got into the back, they drug out this 35-year-old male and kind of dropped him down on the sidewalk. I happened to be there. I'd driven my truck around there, and I had my stethoscope with me. And I listened. He had a good heart, but he was not breathing. I did everything I knew to do to stimulate him, and it didn't work. So I turned to the police officers. The ambulance hadn't shown up yet. And I said, do you have, any of you have Narcan? There were a group of officers stand and they said, "Oh yeah, we all have Narcan, but we can't use it because it's out of date." And I thought, okay, how ridiculous. So I run to my vehicle, get my Narcan that I had, came back and gave him the spray in his right nostril. He kind of opened his eyes and then went back again. I gave him a second spray, at which point he just stood up and was not completely coherent, but certainly was coherent. Asked him if he'd taken fentanyl and that I was a doctor and I wanted to help him. He said, yes, he had snorted some fentanyl up at the traffic light. Long story short, this man, if I had not had Narcan with me, because police officers weren't going to use theirs, then this young man wouldn't be alive today. Narcan has an expiration date. It's about 3 or 4 years, but if you use it past that time, it's perfectly acceptable. It's not going to hurt anybody, but you have a chance of helping someone. The Narcan I used was 7 years out of date. So I would encourage you, whether you're a healthcare professional or not, but certainly if you're a family member where someone has opioid use disorder, please have Narcan available. Have it in your vehicle, in your home, in your office. It will give you the opportunity to save someone's life. Thank you very much.
Thank you, Dr. Easterling. Your commitment to public health truly shows your passion for the cause. Next up, we have Ruth Ann Rigby, the Chief Development Officer of Capstone Wellness and the co-founder of First Responders Mississippi. She brings more than 26 years of experience in the behavioral health and addiction recovery field, with over 27 years in recovery herself. As Chief Development Officer, she supports Capstone Wellness, which has been dedicated to assisting individuals and families in overcoming challenges related to trauma, substance use, mental health struggles, addictive behaviors, and more for over 2 decades. A prominent figure in the recovery and mental health industry, she has worked with some of the leading treatment providers in the nation. In 2022, she received the Dr. Jasper Chin C. Volunteer Leadership Award from the National Association of Treatment Providers in recognition of her outstanding leadership, volunteerism, and mentorship to countless professionals. Along with her husband, retired Lieutenant Colonel Joseph Rigby, she is also a co-founder of First Responders of Mississippi, which provides aid, wellness, and hope to first responders and agencies in their time of greatest need. Here now is Ruth Ann.
Hi, everyone. My name is Ruth Ann Rigby, and I live in Madison, Mississippi. And I'm going to talk to you today about something that I'm very passionate about, and that's helping people that are struggling. And really, the partnerships that we have here in the state of Mississippi that can help you any way, shape, or form, no matter what your struggle is. I am the Chief Development Officer at Capstone Wellness, located in Searcy, Arkansas, and I'm also the co-founder of First Responders of Mississippi, that helps first responders, their families, and agencies in their greatest time of need. One other thing I'd like to tell you is I'm also a person in long-term recovery. I have 27 and a half years of sobriety. I didn't get here the easy way. I got here the hard way with a lot of hard work. And so my purpose and passion is helping people that are struggling get to the right level of care, no matter what their struggle is. I travel all the time. This is a Naloxone kit. I travel on airplanes every week for work. And this is what a kit looks like. This is my new kit. But and in Mississippi, it's from OD. You can get a free Naloxone kit from odfree.org. And I think it's imperative that everybody have their own Naloxone kit. You can also buy Narcan at Walgreens and other pharmacies, because you never know when you're going to come in contact with a person who's going to need medical assistance right away, and you may not have the time to dial 911, and you may have to start using Narcan immediately. So those are some of the things that are very helpful resources in our community and throughout our state. But, you know, I want to just encourage family members who have a loved one that are struggling to please, please, please reach out and ask for help, because you're not in this alone. There are great navigators. I call them navigators. There are people that can help navigate your journey for you. and help you get the resources that you need, whether you have insurance or not. No one in the state of Mississippi should never have to be able to get treatment. There are great grants available for treatment. Certainly, Mississippi was one of the states that reaped the benefit of opioid and heroin money that is actually used to pay for treatment resources for individuals that are seeking treatment. So there's a lot of options out there for people seeking a new way of life that are drug-free, certainly. But when people call me, honestly, it's DEFCON 1, and it's either life or death. And so everybody needs to have someone that they can call when they're going through this situation, whether it's 911, whether it's 988. There's always help available for you. And I'm one of the co-founders of the Opioid and Heroin Summit that we started here in Mississippi many years ago. Oh, I think it was about 2015, 2016, and we didn't have naloxone then. And fast forward to 2024, look at the ways that we're actually now able to help those that are in critical life-saving issues from an overdose, that we can breathe them back to life very quickly with naloxone. And I think that is a huge benefit for people to know that. It doesn't give you, and we have people who are struggling with substance abuse who think it's the end all. If they can't get the help that they need. And it's not, people can go to treatment the easy way or the hard way. The good thing about the great state of Mississippi is that we passed a new law that went into effect yesterday that it helps families who are looking for court commitments, who maybe they have a loved one that is not willing to go to treatment, but they can go through the court system through their local mental health center and get the help that they need that way. That is a huge win for the state of Mississippi and for us to be able to help Mississippians that are struggling. There's also there's a private court commitment that those who are looking to go out of the state of Mississippi for treatment can also access. So there's many ways to access care in the state of Mississippi. But just know, I don't want to put a Band-Aid on someone who's out there struggling, who keeps going back to the drug dealer to get fentanyl and keep using, because that's not dealing with the issues that individual is having. That's just putting a Band-Aid on it. And, if we can talk about prevention, and I'll keep talking about this, prevention is prevention, which is education. That's what we're doing here today. Intervention is, partnering with a trained individual that can help you or your family navigate what steps does it look like next for you to truly get the help that you need, and then finding a treatment partner that you can go to treatment and get the help that you need. And that's going to lead you into your recovery path. And like I said at the beginning of this, I've been clean and sober 27 and a half years, and I didn't get to recovery the easy way. I went by a court commitment. So I'm a huge advocate for court commitments for those who are seeking treatment who cannot necessarily make the decision on their own. So there's many ways out there that we can help your loved ones who are struggling. And so everybody needs to get trained up and be educated and know how to administer naloxone. There's no charge for it if you order it from odfree.org, or you can pick it up at Walgreens. It's like $45. And so those are the great resources that we have here in the state of Mississippi that, because we care about our Mississippians, and those are the initiatives that we've taken. So I hope that this has helped you in some way, shape, or form. If I can be of assistance to you and your family, please don't hesitate to reach out to me. You can find me on the platforms out there in the universe.
Thank you, Ruth, for sharing your story and the work you do. We are lucky to have your continued impact in the space of prevention, treatment, and recovery. Our next speaker, Charlotte Bryant, has been outreach coordinator for the Stand Up Mississippi campaign for over 3 years, a campaign designed to raise awareness about the dangers of opioid misuse and to direct people who are either uninsured or underinsured to resources for treatment. Through the Stand Up Mississippi campaign, Charlotte provides community and customized opioid workplace awareness initiative trainings. She also provides training to first responders, law enforcement officers, schools, and the community on the proper use of naloxone, an overdose reversal medication. Charlotte is trained in youth and adult mental health first aid. Her experience includes working with the Department of Education for over 25 years, where she served as state director with several student organizations, providing students with leadership and academic skill training. Charlotte, we're excited to hear from you and learn more about your work.
Hi, thank you for having me. My name is Charlotte Bryant, and I work with the Mississippi Department of Mental Health, and I work with the opioid outreach program, and I serve as the outreach coordinator. Our program initially started in 2016. It started in 2016 as a result of the opioid crisis that most states were involved with. Not that it was centered in any particular state, but every state was having the same problem. And so the program started as a result of what we were seeing. We had over 201 million dosage units of opioids dispensed to about 2.9 million citizens. Mississippi is a small rural state. We had 67 dosage units per person. We were fourth in the highest per capita state in opioid prescriptions. 99 reported overdose deaths by our state coroner. We had 211 overdose deaths certified with vital statistics. Everything is based on data. And so 67 of the 82 counties in Mississippi had more prescription opioid prescriptions than they did residents. So something had to be done. So what was created was what we call Stand Up Mississippi. It's an initiative to put an end to the opioid crisis in our state and to inspire all Mississippians to be brave, bold, and better together as we fight to eliminate the opioid crisis. Building the multiple agency partnership was very strategic. They involved law enforcement, doctors, hospitals, public service, the community, our community colleges, our universities, and of course, they also involved law enforcement. Our goal was to reduce substance use, increase education, and promote and strengthen partnerships, building with those partnerships. And we also wanted to promote treatment for those substance use disorders or recovery. We want to build on that recovery for our substance use disorders. Stand Up Mississippi is a great initiative. It stands alone. It's a part of the Department of Mental Health, but it stands alone. It's an entire website devoted to education, prevention, and the resources that a person may need. So a person could go online and do the Narcan training. We have a module that's there broken down into 3 trainings. They go through the training and then it'll print them a certificate. We also have virtual training. It's important that people are trained so that they understand. It's one thing to watch a video. It's another thing to have a person there so you can ask questions. And that's really what we want to do, is make sure we have a well-informed communities. So a part of that is being able to virtually train those persons. We were able to train some upward bound students who will be working with some students through summer camps. The knowledge that they gained in that program to better help them understand what they're seeing, how to identify a person that may have a substance use disorder is tremendous. So programs like this help them to better understand. Stand Up also has on their website our treatment centers. That is the most trafficked page on the Stand Up website, aside from the testimonials. A lot of times what a person needs is I see myself in this person. And that's all they need to say, I can do this. And so what we want to do is try to help a person see that recovery is indeed possible, not just tell them that, but help them to see that. So a part of what we do with the Stand Up Mississippi website is to provide those services that they otherwise would not see, the testimonials, the trainings, the resources that they could download for themselves. That we have posters where they can download so they can see what the signs of an opioid overdose are and be able to determine whether this is an actual if they can, to the best of their ability, to determine if that person is in an opioid overdose or if that person is having a heart attack or something else. We also provide them with information to help protect themselves as they're helping someone else. I do appreciate you all giving us this opportunity to say what we're doing here in the state. Mississippi, as when we started, was fourth in prescription opioids being written. We're still about fourth or fifth now. At 1 minute we're fourth, and then we may be fifth, but we're still following into that same. But we're also, our numbers decreased in the number of overdose deaths. In a slight decrease, but that's a decrease. Any one life saved is what we're looking to do. So we do appreciate you all giving us this opportunity. We thank you for what you're doing to help get the information out there so people know that there are services that are available to help. And then if they are looking to provide find information on any of those resources or programs that we talked about, they can go to standupms.org. And all of those resources are listed there. We also have information on how they can obtain Narcan at no cost, even though it's available over the counter at most pharmacies. It also is available through some of the people that we collaborate with at no cost to individuals. So that information is also available on our website. Again, a wealth of information in one place, standupmississippi.org. Again, thank you so much for having us.
Thank you, Charlotte. It's an honor to hear about your efforts in prevention and treatment and the impact that they have on your community.
For our next speaker, we have Dwight Owens. In 2005, at just 23, Dwight's life was changed when a drunk driver caused a horrible car accident, resulting in severe injuries, including broken bones, punctured lungs, brain trauma, and a severed spinal cord, leading to lifelong paralysis. Despite coding immediately after the accident, doctors giving him no chance of survival, Dwight defied the odds. Transforming his tragedy into triumph, he emerged as a national sought-after motivational speaker, author, and advocate for mental health, disability awareness, and addiction prevention. Dwight is currently the program coordinator for Prevention Includes Everyone, or PI, a pioneering initiative under the ARC of Mississippi. PI is known for its inclusive prevention efforts as its support extends to all individuals with physical, intellectual, and developmental disability. Dwight's philosophy is life doesn't have to be perfect to be wonderful, emphasizing strength, resilience, and helping others. Here now is Dwight with his inspiring remarks.
Hello, I'm grateful for this opportunity. I appreciate CACA and all they do. I also appreciate the Mississippi Department of Mental Health for being the bridge to independence and hope in regard to prevention and addiction services in our state. First of all, I would like to say that addiction doesn't discriminate. It doesn't care how much money you have. It doesn't care what kind of car you drive, where you live. It doesn't care about your political affiliation, who your parents are, or who you know. So anybody can be a victim. But I believe that naloxone is a great tool in addressing the opioid crisis and saving lives affected by addiction. Its ability to reverse the effects of an opioid overdose, regardless of who is experiencing it, emphasizes that addiction truly doesn't discriminate. And because addictive behaviors do not discriminate, neither should prevention efforts. But there's a large population of people that are more vulnerable to addiction that are often left behind. In that regard, did you know that individuals with physical, intellectual, and developmental disabilities are more likely to have a substance abuse disorder, but less likely to get effective treatment compared to those without disabilities? for many reasons, whether it be the IQ level for IDD or program accessibility for others with physical disabilities and beyond. And that brings you to our program. So let me introduce. Our program is Prevention Includes Everyone, where we believe that inclusion is important and that no one should be left behind. The Prevention Includes Everyone program, also known as PI, is an initiative under the ARC of Mississippi. It is not just an intervention, but it's a movement that is reshaping perceptions, creating inclusive spaces, and giving hope to those that may not have a voice. I mean, it's a fact that most people don't get involved with advocating for those with disabilities until it impacts them personally. So it is our intent to educate and support all people who may or may not be impacted by mental health conditions, abuse and addiction, or intellectual and developmental disabilities. Training and personal experience has taught us that loneliness and addiction go hand in hand for a large number of people suffering from a substance abuse disorder, especially in the disability community. This topic is very important to me. Several years ago, as a person who has a hospital ministry, was in the hospital visiting a person who had a new disability, was involved in a car accident. Her name was Amanda. Amanda went to the hospital to see Amanda because we got the call to say that she was feeling hopeless because she had this new condition and that just turned her life upside down. So Amanda's now paralyzed from the waist down. We went in to see Amanda, and Amanda's husband at the time asked her for a divorce while she was going through that. Amanda was young because the husband couldn't imagine being able to care for somebody for the rest of his life. And I remember looking at Amanda and telling Amanda that sometimes you have to leave what you want to find what you deserve. Well, later on, I got the call after that Amanda was found after she got home a year later. I got the call that said Amanda was found dead in a ditch, drug overdose. See, Amanda felt paralyzed in more ways than just one. She felt misunderstood and trapped in a world that she didn't belong. And so this topic is so important to me because I want to be able to I mean, now that we know that we have the power to prevent those things. You know, I was hit by, you can't see it, but I was hit by a drunk driver in 2005, and I'm paralyzed in a chair, in this wheelchair that I sit in right now. Paralyzed from the waist down. I realize that I'm physically paralyzed. I can't walk. No one has to tell me that I live it every day. But you can be paralyzed without being in a wheelchair. At PI, we recognize we recognize everyone's need to belong. So we provide inclusive motivational assemblies all across the state. We provide education, disability etiquette training, partnering with other prevention organizations like Dream of Hattiesburg and Metro Jackson Community Prevention Coalition. We continue to work with stakeholders and build relationships. In regard to Naloxone, I'm so proud to see what programs in our state are doing. We have odfree.org, where anyone can request a kit at no cost. You can also visit that site to find the nearest place near you to pick up a free Naloxone kit. By having Naloxone readily available, it can help save the lives of individuals who are experiencing an overdose regardless of their backgrounds. I also give kudos to the training initiatives and education provided by the Mississippi Public Health Institute in our state. I encourage you to reach out to the Mississippi Public Health Institute. Visit odfree.org. Reach out to the Mississippi Department of Mental Health. Reach out to us at the ARC of Mississippi. The resources are there. Speaking of us, our program is more than just a name. Prevention Includes Everyone is a clear statement that no one, especially those within the IDD community, should be invisible or left behind in the fight against addiction. It embodies a message of hope and inclusion, a testament that every individual, regardless of their abilities, deserves the right to education, support, and treatment in facing the challenges of substance abuse and other addictions. As PI continues to break ground and foster change, we invite all families, professionals, and communities to join us in creating a safer, more understanding world where prevention truly includes everyone. In conclusion, it's a great thing to have a tool like Narcan to prevent an overdose fatality because everyone deserves to live a life that they're excited about. Addiction is real, but so is hope. Prevention includes everyone.
Dwight, thank you for sharing your story. Your effort to make the world a better place despite adversity is truly inspiring.
Our final speaker for the day is Jody Fortenberry. Jody is the Peer Support Services Projects Coordinator for the Mississippi Department of Mental Health, ensuring high-quality mental health services for all Mississippians. Particularly, peer support services is her life's passion. Her previous role was homeless coordinator for the city of Hattiesburg, where she worked toward the same goal. Jody has worked in the field of mental health her entire career, providing services to several populations of vulnerable people in Mississippi and Louisiana. Take it away, Jody.
Hi, my name is Jody Fortenberry, and I am with the Mississippi Department of Mental Health. I am the Peer Support Services Project Coordinator for our division, which is Peer Recovery and Support. So to tell you a little bit about peer support, and particularly how peer support is aiding in overdose prevention in Mississippi, peer support services are rooted in the knowledge that recovery from mental illness and or substance misuse is not only possible, but likely given the proper supports. That's not a message that we hear very often, especially outside the mental health system, where a lot of times there's an assumption that if a person has a mental health disorder or a substance use disorder, that perhaps they cannot come back from that. Perhaps there is no recovery, when in fact there absolutely is the potential for recovery for every human being, as long as they're given the proper supports. And peer support is an evidence-based support to help aid people in maintaining their recovery once they have reached the recovery and reaching recovery. So peer support is a process whereby individuals with lived or living experience of a particular phenomenon provide support in evidence-based, strengths-based, non-clinical services to others by explicitly drawing on these experiences. Activism and advocacy are the heart of peer support services, which are always person-centered and recovery-oriented. Recovery and the potential for recovery is the heart of peer support services, because peers are people who have been there, done that, and so they hold a lot of credibility with people who are struggling with those situations right now and are able to model recovery. The empowerment gained from achieving and maintaining recovery leads peer support specialists to empower others and to use their voices to fight for increasing access to effective substance use and mental health services for all people. Peer support is evidence-based and proven to be as or more effective than clinical services, particularly in substance use settings. Its effectiveness is derived from a variety of psychosocial processes. And in terms of the opioid crisis, peers play a pivotal role in overdose prevention interventions, including harm reduction. And in Mississippi, particularly harm reduction for people who use opioids and other illicit drugs, and are essential to the acceptability and feasibility for such services. Peers lead in a meaningful way, reducing both harms associated with illicit drug use and the related structural violence that accompanies it. The role of peers in connecting with individuals due to their unique identity and role is crucial to provision of safer spaces. In communities underserved by safer environments for drug use, several studies recognized involving peers in the delivery of harm reduction services, specifically in outreach to people who use drugs, as being useful in reaching those who were injecting drugs in public, women, and those who injected alone. These are high-risk groups that very often only peers can access because of the nature of that peer relationship, as opposed to a clinical service where they do not have a peer relationship, and the clinical services are looked more as an authority figure, where peers are been there, done that, let me show you how I did it. So out there every day, peer support is working in prevention for opioid use disorders and prevention daily, just by the very essence of our work. We are out there, boots on the ground, dealing with individuals where they are, providing services where they are, and we're welcomed into spaces that other services are not necessarily welcomed into because we have a peer relationship. Peer support services in the state of Mississippi are accessed through the Department of Mental Health. And if anyone is interested in becoming a peer support specialist, someone who has lived experience with substance use disorder, mental health disorders, or both, very often we see co-occurring disorders. If anyone has anyone in their family who has gone through these sorts of struggles, themselves gone through these sorts of struggles, and they would like to devote their life to helping others find recovery and maintaining recovery, the Mississippi Department of Mental Health's website has the application for the Certified Peer Support Specialist training. Anyone can access that application from our website and follow the very easy steps and instructions for the application process, and we would love to have you. Peer support services in Mississippi will continue to work hand in hand with those experiencing substance use disorders, particularly opioid use disorders, and will continue to support Mississippians where they are with what they need at the time that they need it, with no judgment and no authority. It is a relationship-based service that is highly effective, and we will continue our work in bringing those services to the people of Mississippi who desperately need it. So thank you.
Thank you so much, Jody, for taking the time to talk about such a valuable resource. We appreciate your essential contribution to the cause.
Thank you again to each of our speakers today. They are doing so much to raise awareness and expand services in this challenging environment. And now we'll review the overdose prevention stimulation portion of this event. Walmart has invested in virtual reality equipped training facilities for their associates to build skills in unique situations that are hard to replicate in a classroom setting like front of store shopping experiences and emergency preparedness simulation. This technology leads to the development of non-retail training such as the VR, which we will see next. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer Naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
We want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and insight. And finally, thank you so much to all of you for supporting the Mississippi Department of Mental Health and the Great Mississippi Coalitions local to your community. Please reach out to our friends at CACA, Olivia Murphy Costanzo, Business Development Associate, Sean Moore, Senior Manager, Special Projects and Initiatives, and Mia Wallace, Director of Business Development, anytime with your suggestions and questions. The CACA team is looking forward to discussing this more and getting your tremendous feedback. This now concludes our webinar. I wish you a great rest of the week.